Hi, my name is Brady Carlson. My topic is one that has gained a lot of popularity and has been extensively researched recently, as ketamine, psilocybin, and MDMA, when taken alongside psychotherapy, have been proven to help alleviate symptoms of depression, anxiety, and PTSD. Before I dive into the research, I want to focus on an individual named Maddie. Now, many of you probably know individuals like Maddie or who are in similar circumstances as her. Maddie has suffered from anxiety and depression for the majority of her life. She's had feelings of hopelessness, despair, worthlessness, and even suicidal ideations. And Maddie has gone to different therapists and has tried a wide variety of medications, but despite her best efforts, she has still not found any relief from her symptoms. Recently, Maddie has started seeing a new therapist who has introduced the idea of trying psychoactive substances alongside psychotherapy. Having tried every other possible avenue, she is curious and interested in this possibility, so she does some research online. And from her research, she sees that 3 different substances, ketamine, psilocybin, and MDMA, have been proven to be beneficial for people just like her. Also, through her research, she notices some potential negative ideas and views towards some of these substances, such as psilocybin, known as the magic mushrooms, or MDMA, known by its street name Molly. So naturally, she is hesitant to try any of these substances. And 3 thoughts appear into her mind. The first thought is, will these substances even work for me? Second is, could I become addicted? And last, are they harmful to my overall health? Maddie's concerns are very common and also very valid. These concerns are ones that many have when contemplating whether taking psychoactive substances. Maddie likely suffers from a condition called treatment-resistant depression. This is when individuals have tried different types of therapies and different medications, but yet still have not found any relief from their symptoms and still experience feelings of depression, anxiety, and PTSD. So what can individuals like Maddie do? Where can they go? What different avenues, after trying everything, can they do to find relief? Well, recently, ketamine has been shown to help to be a great use to combat treatment-resistant depression. After using a low-dose IV treatment of ketamine, 91% of participants stopped using benzodiazepines. And benzodiazepines are medications like Xanax, Klonopin, and Lonazepam. So these individuals completely stopped using their benzodiazepine. 64% didn't completely stop their medication, but their dosage went increasingly down. Ketamine has this effect because of the rapid antidepressant effects that it has. When you compare this to common SSRIs, which are medications that many take to help treat anxiety or depression, they normally take full effect within weeks or even a month upon first administration, versus ketamine, which has an antidepressant effect within hours of administration. Psilocybin has also been proven to be a great use for those suffering from TRD. Those taking a heavy dose of psilocybin have been able to find complete remission from their symptoms. In fact, 8 out of 12 participants no longer qualified as having treatment-resistant depression after taking the heavy dose of psilocybin. Again, it's due to the fast-acting antidepressant effects that these substances have compared to traditional antidepressants. So further research on psilocybin and how it can help those suffering from depression are those who take a high dose of psilocybin have been able to find 60 to 80% relief and reduction in their symptoms. These substances are able to do that because they target specific neurotransmitters, specifically the GABA neurotransmitters and the serotonin neurotransmitters. Serotonin specifically is a neurotransmitter that focuses on emotion, cognition, and specifically mood regulation. The second question that Maddie had is, can I become addicted to this substance? Will I become dependent on it? If you ask anyone on the street or anyone today in society, their answer is going to be yes, that these substances are very addictive. However, recent studies have shown that the addictive properties of these substances are very low, and the chances of becoming addictive or having withdrawal symptoms are very, very low. In fact, those who suffer from a substance use disorder like cocaine addiction or heroin addiction can find relief from their disorders. Those suffering from any of these disorders can find reduced cravings, reduction in anxiety, and also can find a switch in their emotions, so their view towards their addictions can change and alter after taking psychoactive substances such as ketamine or psilocybin or even MDMA. The third question that she had was, are these substances safe? When we compare them to traditional treatments such as SSRIs, we can examine the side effects. So common side effects of an SSRI are nausea, headaches, dry mouth, dizziness, sexual dysfunction. And so when we compare that to typical or psychoactive substances such as, for example, MDMA or ketamine, the side effects are very, very similar. Patients will still experience nausea, sexual dysfunction, insomnia, dizziness, fatigue, etc. In fact, when comparing the two, patients who took MDMA continued 6.8% did not continue versus the 28% of those taking an SSRI. So those who were taking an MDMA treatments were more likely to continue taking MDMA as an SSRI because of the benefits and the relief that they received from MDMA versus the traditional SSRI. So what does this mean for society, for medicine, and for people like Maddie? Well, we can try and answer some of her questions. Will it work for her? Could she become addictive? And is it harmful to her health? These questions will likely change if they are not taken alongside psychotherapy. The efficacy is drastically decreased. They can become addictive, and safety is also decreased when they are not taken alongside psychotherapy. The need for these substances to be taken alongside psychotherapy cannot be overstated. Patients are able to cope, safety is increased, risk is decreased, and they're able to process emotions. Imagine that you're taking one of these substances by yourself. You're likely going to be experiencing feelings of fear, anxiety, depression, confusion. But when taken alongside psychotherapy and under the direction of a healthcare professional, these emotions can be able to be processed. Patients are mindful of what's going on, and correct dosages and proper procedures are in place. Those who are thinking about engaging in psychoactive substances should first consult with a healthcare professional. Healthcare professionals can assess individuals in making sure that, based on their medical history, current mental medications, and their mental health disorders and conditions, whether they are a good candidate for psychoactive drug-assisted psychotherapy, and they can determine which kind of substance would be most beneficial for them. Lastly, these psychoactive substances offer patients and people like Maddie a glimmer of hope. Those suffering from TRD or any type of mental disorder can find remission and relief from their symptoms, even after they have tried every other possible avenue. And we can also reduce the stigma surrounding these substances and offer them a place in medicine. If you have any questions about any of my research or about any of these substances, you can email me at bradyec@bue.edu, or you can go online to the National Institute of Health and search how psychedelic drugs may help with depression. Thank you.